is Ariel Valancourt. I am in my master's program here at Merrimack, and today I'm going to be presenting on exertional compartment syndrome. So, exertional compartment syndrome is an exercise induced muscle and nerve condition. It causes pain, swelling, and can sometimes cause disability to the affected area, affected limb, affected muscles. Compartment syndrome is, or exertional compartment syndrome is often bilateral, and it's usually overlooked or misdiagnosed as shin splints or muscle soreness. And we want to make sure we can detect this early to prevent further or permanent damage. It can affect anybody, but we most often see it in endurance athletes. And for the sake of the poster, I did a case study on an athlete that I worked with at one of my clinical rotations. She was a cross country athlete, and she reported some red flag symptoms that made us go right to what we suspected to be exertional compartment syndrome. She complained of having pain during exercise, and she said that she could usually get 2 miles into her run before feeling it. And then the pain that she was experiencing was kind of like a deep and hollow pain. And then she was getting numbness and tingling down into her feet. And she said that the pain that she was experiencing was worse during exercise, but after exercise, it was pretty much debilitating for the rest of the night. Along with exertional compartment syndrome, if you see an athlete who you suspect might have it, they also might be weak in whatever like limb they're experiencing it in. They can also have noticeable swelling or point tenderness. Usually, you can kind of feel it when you're palpating. For the athlete that I worked with, we referred her to a team physician. He ordered an MRI and then also ordered compartment pressure testing. Compartment pressure testing is the number one, like most reliable test when it comes to diagnosing compartment syndrome. And during this time, we completely shut the athlete off from exercise just because that was making her symptoms worse. We also paired treatment along with the shutdown from exercise. We paired her with some deep tissue massage and then deep heating through ultrasound, which in the end did resolve her symptoms, which was good. She was no longer getting that pain that she was experiencing while exercising. My athlete did need a fasciotomy, which is just when they go in and release the pressure from your compartments. And we did some pre surgery rehab, just range of motion, contraction type exercises in order to try and build up some muscle so that less was lost post surgery. And then I actually had to leave the clinical site due to COVID. The school got shut down. So I would assume that they did some rehab after as well to build back up that muscle. But I thought it'd be a fun topic to do and educate people about, especially people that might not know, just because it is often overlooked. And again, we do need to detect it early. So thank you guys so much for listening. I hope you have a good day.